Today I'm going to give a presentation on patient rights. My name is Trisha Brandis. After this presentation, you will be knowledgeable about medical records ownership, the basic rights every patient should know, and patient consent forms, as well as your responsibility as a patient for your care and the confidentiality every physician should uphold. Medical records. Let's begin here. You own all the information within your medical record, but the provider owns the physical medical record. It is the responsibility of the physician and the patient to ensure that the accuracy of the medical record is thorough. All the basic rights every patient should know. The right to admission. You should always be given the care that you need at any facility that you present with a medical condition. The right to discharge. You can discharge yourself from a facility at any time. You do have to give your written consent and all acknowledgments that you understand the risk and the liability that you take by leaving. And patient obligation. In addition to receiving and denying care, it is also important you provide full and truthful health information to your provider. One of the most crucial patient rights is informed consent. The right to informed consent gives patients the opportunity to understand details of recommended procedures or treatments, any possible risks that a treatment or a procedure can cause, time needed to recover from any procedure, and alternative options for every procedure and treatment. It is important that a patient receives all of the information to make the best choice they can about their care. The patient responsibility. It is your responsibility to comply with your doctor's orders, follow course of treatment and instructions, respect the rights and privacy of all other patients, respect caregivers, and fulfill financial obligations promptly. Observe hospital policies and procedures, and be considerate of healthcare facilities. Last but not least, the confidentiality that a physician must uphold. Anything shared with your physician will not be shared unless necessary for treatment. This falls under the principle of privilege. An example could be attorney-client privilege or spousal privilege. Anything you tell your provider will not be shared outside of the exam room or the operating room. Physicians need your approval before they can share healthcare information, except if they're consulting with another physician on your condition, or if they observe any elder abuse or suspect any abuse to an elderly person. And always ask questions. No question is irrelevant, and we as healthcare providers want to make sure that you understand exactly what we are treating you for, all the risks, all the benefits, and all the financial obligations. So make sure you ask the physician to restate the information if you don't understand, ask the physician to explain the information in a different context, or even show you a diagram if you don't understand where a procedure is going to be on your body. Repeat the information back to any medical staff so that you can ensure that they think you have understood the information properly. Okay, so that's the presentation. Now, what do you think?
About the questions or about the presentation itself?
The presentation itself. Do you feel like you knew all that information before?
No, not at all. Some of it I did not know.
Okay.
I didn't know I had the right to discharge myself, and I knew some of the physician, doctor-patient, confidentiality thing, but I didn't know they had the right to ask another physician. There's a few things on there I didn't know. Very informative.
Okay, so you think this would be helpful if you had been given this at your facility or your provider's office?
Most definitely.
Okay.
Most definitely.
Now I have a quick question. How many times have you actually been given the privacy rules on a sheet of paper to read, and have you ever read it?
Almost every time you do get something, when I have had the procedures I've had,
Yeah.
but it's so long and so listed and so uncomprehensible by a normal human being that you just skip over it. You know, you just accept it.
Okay. Okay, because I've always been curious to ask somebody that, so. Okay. Well, thank you, Dad.
You're welcome, baby. You did good. You did real good. You kept me kind of interested.